Why are aromatase inhibitors used instead of older anti-estrogens? Imagine a treatment that targets the very source of estrogen in the body to fight hormone receptor-positive breast cancer. That's what aromatase inhibitors do. They are often chosen over older drugs like tamoxifen because they can be more effective in certain situations, especially for women who are postmenopausal. Breast cancers that are estrogen receptor positive depend on estrogen to grow. Hormone therapies aim to block this growth signal. Older antiestrogens like tamoxifen work by blocking estrogen from binding to cancer cells. They are effective in both premenopausal and postmenopausal women. But tamoxifen does not lower the overall amount of estrogen in the body. It just prevents estrogen from stimulating cancer cells. Aromatase inhibitors work differently. They block an enzyme called aromatase, which converts other hormones into estrogen in fat tissue and other parts of the body outside the ovaries. After menopause, the ovaries stop producing estrogen, but aromatase in fat tissue keeps making small amounts. By inhibiting aromatase, these drugs drastically lower estrogen levels, often to indetectable levels. This starves the cancer cells of estrogen, making the treatment more effective. Why are aromatase inhibitors preferred in postmenopausal women? Because they target the main source of estrogen after menopause. Studies have shown that EYs lead to better outcomes in preventing cancer recurrence compared to tamoxifen in this group. They are especially useful when the goal is to lower estrogen levels as much as possible. However, aromatase inhibitors are not usually used in premenopausal women. That's because their ovaries still produce large amounts of estrogen, which EYs cannot block effectively. In some cases, if ovarian function is suppressed with medication or surgery, EYs can be used in premenopausal women. Common aromatase inhibitors include drugs like anastrozole, letrozole, and exemestane. They are typically prescribed for women with hormone receptor-positive breast cancer who are postmenopausal. Side effects differ from those of tamoxifen. Aromatase inhibitors may cause joint pain and bone thinning, while tamoxifen can increase the risk of blood clots and uterine cancer. In summary, aromatase inhibitors are used instead of older antiestrogens mainly because they lower estrogen levels more effectively in postmenopausal women. This leads to better control of hormone-driven breast cancer and reduces the chance of recurrence. The choice of therapy depends on individual factors like menopausal status, side effect profiles, and personal health history. Always consult with a healthcare professional to determine the best treatment plan for each person's unique situation.